Hi, I'm Tom Anderson from the Stebney Hawkins Clinic of the Carolinas. I'm an orthopedic surgeon who specializes in foot and ankle surgery. I want to talk to you a little bit about the acute treatment of sprains. This could be for any joint that you sprain, but I'm going to primarily talk about sprained ankles, since that is one of the most common areas. You may or may not be familiar with the acronym RICE, R-I-C-E, and that's used in acute treatment for sprains. We'll break down each one of these letters and tell you what they mean. Okay, so if you're out playing a sport or working around your yard and you turn your ankle over, you have swelling and pain, your immediate treatment, if you're pretty certain it's not a more severe injury like a fracture, is to begin with what we call rest. So you'll get your weight off the foot immediately. Ice is the I, and you put ice on it. And what this does is try to decrease the swelling and the bleeding in the area. The more soft tissue change that occurs with the swelling, the longer it takes to get you to heal. So the ice is very important initially. Compression is the third part of the RICE acronym, and I think it's important to know how much compression, but light compression around there will also aid in preventing the joint from swelling. Now, be careful not to over-tighten it, do anything that would cause tingling or blanching of your toes beyond where you wrap it, but a firm ACE wrap or a type of brace that you may have will help alleviate some of the swelling. And then lastly, elevation. And people always say, well, how much elevation do you need? Really, the foot just needs to be above the heart. What you want to do is aid the system that brings the blood back to your heart with the use of gravity. And there's really no advantage for it to be much higher than just a few inches above your heart. And so immediately after suffering this injury, you want to think of these things: rest, ice, compression, elevation. Now, the ice is usually very good for on 20, off 20 for the initial couple hours. And the elevation is very important for about the first hour and a half initially, and then using it intermittently after that. These things will help diminish the amount of tissue injury that you have and help you rehab and get back to your normal level of activity much quicker.